Greetings to everyone in the session. My name is Dr. Irja Shaanika from Namibian University of Science and Technology. My presentation is titled Electronic Health Records for Improved Data Sharing during Patients' Mobility across Namibia. The Namibian healthcare system, similar to other countries' healthcare system, is divided into two, which includes the public and private healthcare sector. Basically, the private sector constitutes individuals and group of practitioners that private healthcare services, so they are mostly profit-driven. The public healthcare sector is driven and managed by the government, so it represents a larger part of healthcare industry, and as a result, the government has built hospitals and clinics across the country with the 40 regions. Healthcare services are heterogeneous due to the different healthcare professionals providing them. So you'd find that a patient with a specific sickness is not only attended by one healthcare practitioner, by various healthcare practitioners, and in some cases it could be that these healthcare practitioners, they are not in one location or they are found to one healthcare hospital. So as a result, patients often move from one healthcare facility to another, in and outside the country in search of healthcare. So during this process of patients' mobility, when patients move from one healthcare to another, patients' healthcare records need to be shared among the concerned healthcare professionals. In Namibia, sharing of data during patients' mobility continues to be a challenge across healthcare facilities as there are no electronic healthcare records placed for patients' records. So patients moving between healthcare facilities carry their medical files to the facilities where they are referred to. And as a result, the manual process of sharing patients' data negatively impacts healthcare services delivery in terms of efficiency and its effectiveness, as data is not always timely available, and sometimes medical files get misplaced or even stolen the public hospitals where they are stored or when they are transported by the patients. So due to these challenges, there is a need for public health authorities in Namibia to implement electronic healthcare record as an approach to manage and mitigate data sharing challenges during patients' mobility. So this study aims to investigate the factors affecting the realization of electronic healthcare records across the Namibian public healthcare facilities, and then based on this, develop a model to guide the deployment of electronic healthcare records that will support data sharing among the healthcare facilities as patients move from one location to another in search of the better healthcare services. In the research approach, the study employed a qualitative case study. So a public hospital, which is a referral hospital, was selected as a case. So this was primarily selected because we thought a referral hospital deal with cases of patients moving from one hospital to another, and will be in a better position to tell us more about how do they deal with data management when patients are moved or referred from one hospital and so forth. So the form of data collection, semi-structured interview was used as data collection technique. And before the data collection process began, the researcher sought or went and visited the case in search of the permission to study these participants. And the documentation that we use in searching for permission included ethical clearance application form, where the study or where the researcher indicated how will participants confidentiality will be kept, how will patient identity and data be protected. And there was also another document which was used in this process, participants' informed consent, which was going to be filled in by the participants after they've been informed the study objectives and what is the purpose of the study. And then based on the agreement, they could fill in the informed consent. And part of the package was also the data collection questions which were used by the researcher. So after this, the case study, the case management analyzed all this document. Thereafter, permission was granted, and then a total of 19 participants formed part of this study, of which 5 were patients and then 14 healthcare workers. So the findings presented in this study is that there is unsecure patients' record storage facilities in such that patients' records were stored in boxes and cabinets across the public healthcare hospitals. The mechanisms which were used to secure these storage cabinets were padlocks, and the files were not backed up elsewhere, and in case of accidental cases such as theft or fire, files will be lost permanently with no traceability. And in most cases, when the patients come back to the hospital and so forth, they are requested to retake the medical tests and so forth. So what came out was also the inconvenient data sharing process. There was no data sharing agreements among the hospitals and the practitioners that are involved in the patient referral or treatment. So it was the patient's responsibility to ensure that the referral hospital has their medical files. So there is, as a result, the patient often traveled back to the hospital to get their medical files and then deliver this to the referral hospitals. So the medium of transport used is hand delivery, whereby patients are expected to manually carry their medical files. So as a result, there is a need for an integrated eHealth record system, whereby participants agree that there is a need for an electronic eHealth record system to enable ease of data sharing when patients move or are referred to different public hospitals across the country. So on this slide, a model for the realization of electronic healthcare record for the Namibian public hospitals is presented. So the central concept of this model is that it's the development and implementation of an integrated electronic healthcare record, whereby each hospital, including the referral hospital, will be equipped with an infrastructure or with an instance of electronic health record and is supporting database infrastructures to store and manage their region or locations, patients, medical files, and so forth. And then the dotted lines in the model represents that through the wireless connections, each hospital will be able to extract or access patients' records stored at another healthcare facilities. So obviously the access of patients' data in another facility will be facilitated through secure mechanisms, through login credentials, through firewalls to ensure that to prevent unauthorized access to the hospital's private network. So an integrated healthcare record does not exist in vacuum. It needs other factors to make sure that it's a success, and hence the components that are listed on the left-hand side, which includes data management policies and standards. If hospitals are to share data among themselves, of course, there is a need for policies and standards on how such data will be shared, and also system maintenance infrastructures in terms of the server infrastructures, desktop backup infrastructures, and the security mechanisms that needs to be designed and implemented to ensure that organizational or the public healthcare sector's patients' data is protected from unauthorized uses and so forth. And there's also a need to bring board or to sensitize people about the benefits of electronic healthcare record. So this is both to the healthcare practitioners, to the technical expertise. They need to be taught and trained on the use of electronic healthcare record. So the diffusion mechanisms that can be implemented is components such as systems trainings or workshops on the various features of the system that is being implemented to support patients' data sharing during the mobility process. So this is in terms of these factors which were covered in the model, they are explained further here to say that There is a need for an integrated electronic health record whereby if hospitals operate an integrated electronic healthcare record, it promotes ease of communication between the healthcare practitioners that are part of the patient's treatment. So the healthcare practitioners will be able to trace the patient's medical history with ease. They will be able to trace how far the patient has come with this specific sickness, or what is the progress done so far on this treatment and so forth. So there's also a need for data management policies and standards. As such, different types of healthcare stakeholders, which includes the government, which is the main stakeholder in this, the business partners, as well as the technical people or personnel, must be included in the development and implementation of data management policies and standards. There is no way that these hospitals will be able to share data across each other or among themselves if there are no policies and standards to govern the interaction or the communication between the implemented systems. So there's also a need for system maintenance infrastructures to ensure that the development and implementation of electronic healthcare record system is not a once-off activity, but it needs to be supported to enable business continuation. As such, the system should be running to ensure that the healthcare practitioners are able to record efficiently the patient's data as well as retrieve any time that the data is required or requested. So there is also a need for electronic healthcare record diffusion mechanism, and this can be achieved through trainings. Employees need to familiarize themselves with the new technology features and acquire the necessary skills for using electronic healthcare record. So these electronic healthcare record diffusion mechanisms are not mainly tailored only for the functional expertise, but as well as to the technical team. They need to be sensitized or receive skills or training on how can they go on to support the system to ensure that it's continuation in terms of their functionalities, or to integrate the latest technologies as they appear on the market. So in conclusion, we are saying that mobility of patients necessitates data sharing among healthcare professionals. However, the manual process of sharing patients' data and medical files continue to be a big challenge among many countries' public hospitals, including Namibia. The designed model can be used as a guide by healthcare management and other stakeholders in developing electronic healthcare record. So basically, this is just a guide on what are some of the factors that the government can consider when developing an electronic healthcare record. This study takes cognizance that the implementation of electronic healthcare record is not sufficient solution for patients' data sharing. There is a need for further investigation into setting up the technical infrastructures as well as the legal frameworks at the national level that will guide and support all the stakeholders that are involved in terms of patients' data sharing, in terms of who needs to have accessibility and who owns the data that is being shared between the hospitals. In conclusion, thank you so much for listening.